Welcome back to the Noon Show on WBAY TV2, and welcome back to one of our favorite guests. Dr. Tyson from Toric Eye Center is with us on Ask the Expert today. It's great to see you again, Doctor.
Thank you.
The eye is a very complicated mechanism, and so there can be a lot going on, a lot of different issues for an individual who might come to see you for something like a cataract or something else. There's a lot going on in there.
Right, exactly. Yeah, so typically if somebody comes in complaining of blurred vision, we diagnose a cataract, we set up an appointment where we can spend literally 2 to 3 hours sometimes figuring out how do they want to see after the surgery, looking at different measurements. And one of the big measurements that we look at is the cornea surface.
So is that where astigmatism comes in? What is astigmatism?
Right, and this is probably a question that I get asked 5 times a day. And the simplest way that I've learned to explain astigmatism is take 2 common shapes, a basketball and a football. And if you cut those in half, put the basketball on the counter, cut the football in half, place it on the counter, they look different. The basketball is spherical. That is a shape that has no astigmatism. The football is defined by 2 different axes and then 2 different curvatures of steepness. So when we look at a patient and we want to determine can we get them to see well without glasses after surgery, we have to figure out how do we accomplish that in an eye with astigmatism. And we actually have lenses called Toric lenses that we can place in the eye and we can counteract that surface that's shaped like a football.
So an individual could come to you just for that, or in the case of, say, a cataract surgery, they could have multiple procedures done within that single procedure, take care of multiple issues at once.
That's right, and this is something that as technology has developed, we can fix astigmatism with our laser during laser-assisted cataract surgery. If the patient wants to spend a little more money, they can essentially purchase a lens that will fix higher amounts of astigmatism, and we have pretty interesting equipment to be able to place those lenses correctly. So the football basically can be oriented in a number of ways, and we take a picture of the eye prior to that, and the imaging instruments will look at the iris and the blood vessel pattern on the surface of the eye, and we learn where the steep part of the cornea is, and then we re-image the eye in surgery, and as I'm placing these lenses, I get a heads-up display in my microscope, and I can orient that lens perfectly.
Toric Eye Center always leading the way in the evolving technology and options available to you. Getting a hold of Dr. Tyson or anyone there is as easy as following the information right on your screen. It's always available 24/7 by going to WBAY.com and clicking on Ask the Expert. Thanks for being here today, Doctor.
Thank you.
We'll get you back into the Noon Show here on WBAY TV2 right after this.